Good afternoon, ladies and gentlemen. Allow me to ride on the protocols that have already been established for the long time that all of you have been here. And it's really an absolute privilege to stand before you at this 10th Africa Health Business Symposium. I think I work with AHB so much until sometimes I'm confused to be an employee because we work so closely. For a decade, this platform has boldly placed health exactly where it belongs, and that is at the center of Africa's economy and the development agenda. So, as we meet today at a critical crossroads, because over the last 20 years, Africa has won hard-fought victories. Life expectancy, maternal and child mortality, the deaths from infectious diseases like HIV, which most of them have drastically reduced. But let's be very brutally honest that these gains are still very fragile. Even when you see maternal and child health going down, there are still other things that are causing the mother to die on that bed. Even when you see HIV issues going down, we still have other non-communicable diseases to deal with. You know, we have TB cases to deal with. So it's a very, very fragile space. And when we see the shrinking foreign aid, crashing debt burdens, and chronic underinvestment threaten to stall our progress, all these are emerging and re-emerging challenges. The message I bring from Kenya today is very uncompromising because health is not a sunk cost. It is the most powerful strategic investment that we have done. And it has been very, very deliberate. And the evidence is undeniable. Investing in health yields massive economic returns. Programs that are supporting maternal and child health, community systems, nutrition, don't just save lives, but they forge human capital, supercharge productivity, and they also drive long-term economic growth. So this is the ultimate business case for why governments, private sector, and our development partners must prioritize health financing to transform the economies. In Kenya, we are walking the talk with our robust universal health coverage. I know my CS was here, my colleague PS was here, and they must have really indulged deeply into our transformative universal health coverage. And since 2023, we haven't just tinkered around the edges, but we have completely rebuilt our healthcare foundation through the 4 transformative flows: the Social Health Insurance Financing Act of 2023, the Digital Health Act of 2023, the Primary Healthcare Act of 2023, the Facility Improvement Financing Act of 2023 that grants our hospitals the autonomy to manage their own funds and respond directly to the local needs, because health in our country is equally devolved and we need the dynamism of every county to be treated as is at the local level. The forthcoming one, which is the Quality of Healthcare and Patient Safety Bill, which will aggressively standardize the care and safeguard patients' outcomes. So together, these reforms, they create an investment grid architecture, and at the core of this is the primary healthcare. It is the first point of contact. It is the bedrock of resilience, people-centered system. And we are deploying our CHPs, the community health promoters, 107, 831. And each one of them has a job to care for 100 households. And this is creating seamless continuum to preventive and curative care. But vision requires funding. Yes, we have rolled them out. We pay them a stipend. We've kitted them. And we need sustainability of the same. So we need funding. Financing dictates the future. In Kenya, we are aggressively shifting from paying for mere inputs to paying for the actual outcomes. So we are rewarding quality care and incentivizing efficiency. We also know a system is only as strong as the people running it. We are tackling workforce shortages head-on through task sharing, relentless mentorship, and strict accountability. Our postgraduate training for professionals, healthcare professionals, is up and running. And every year we have a needs analysis from the counties so that we train the right people for the right needs. Therefore, an investment in our healthcare workers isn't just a health priority, but it is an economic engine for job creation. And I want to challenge this meeting today. When you talk about investment, and especially in healthcare, do not leave out healthcare workers. And not just healthcare workers, but healthcare professionals. We are dealing with issues of One Health. So how are you just going to talk about curative services in the healthcare space when you're not looking at what the Ministry of Agriculture, the Ministry of Environment, the Ministry of Education, and other ministries are dealing with, the people they are working with? So leveraging on public-private partnerships and digital health solutions to expand access and cut the red tape. But listen, Africa does not lack good ideas. We only lack the mechanisms to scale them up. And it's time we move past endless pilot projects that are embedded on proven solutions and permanently and ensure that we have proven solutions that are permanently into our national system. So our true north must always be equity, universal health coverage. It means absolutely nothing if it doesn't reach the most vulnerable, regardless of their social status or geographical location. And that is why our primary health care remains free in our country for all the levels of facilities that are at the primary health care through the social health insurance. So Kenya's journey, it proves that we can build health systems that are legally bulletproof, financially self-sustaining, and operationally integrated systems where quality care is not a privilege but a fundamental human right. So the opportunity before Africa today is to scale these approaches and align our investment with our long-term goals. This is coming at a good time, especially when our transition from dialogue to sustained action could not be. The timing of this conversation is coming at a very good time when we have the World Health Summit region meeting that is coming up next week in just a few days from 27th to 29th, and Kenya will proudly host right here in Nairobi. So we will convene the global health leaders under the theme Reimagining Africa's Health Systems, Innovation, Integration, and Interdependence. And the groundbreaking work that you have done in this meeting is very crucial. The crucial discussions you will have up to the end is going to be the bedrock and the foundation for next week's meeting. The question before us is no longer whether we can afford or invest in health, as we say, but we have the brutal truth that we cannot afford not to. I thank you.